Namaskar.
Considering that it is the last session before lunch, you can give him a warm welcome.
Thank you very much. How much time are you giving me? 10 minutes? 10 minutes. So he already reduced 50%. So I'll go for kiss. Keep it smart and simple. Thank you. Good afternoon, everyone. As I know by the background and by listening to speakers this morning, you will definitely know that I'm not a leader. Either I'm not an entrepreneur. And the topic you look at, do what you love and love what you do, was a great opportunity for me to become an entrepreneur. Because Dr. Bhargav sent me a list of topics. I thought, let me be entrepreneur and selected one. It was not actually chosen by somebody else. So I tried to be a risk taker in selecting a topic and becoming an entrepreneur. And let me see how fair of it. Thank you, Pradeep, for giving me this opportunity to be amongst the leaders in healthcare and the distinguished delegates. I know the time is before lunch, so I'm just filling that gap so that your glucose levels should not go down further. I'll take quick time. So good afternoon once again. Good afternoon, ladies and gentlemen. Thank you very much. And that's the first connection I want to make with myself and you all. Why? Because what we're talking about healthcare, leadership, entrepreneurship, and so on, the first connection between a doctor and a patient is missing. I have been to over 100 hospitals in the country and a couple of other hospitals overseas. And this most important feature, the connection between doctor and patient, is always found missing. Always. The doctors start writing prescription before even looking at the face of the doctor. Please pardon me for saying so, but this is what I have seen. And by the time patient is on the sitting chair, there are X number of tests on the left side of the prescription paper, and just waiting for something else to write some medication for the patient. So what we are talking about? What we are doing? We're talking about healthcare. We are talking about leadership, but the basic thing which is extremely useful for the patient, which is the care and the safety, is missing. So do what you love. Or what you should do, you start loving it. It's a very complex topic. I wanted to become a doctor, could not become for many reasons. Then I wanted to become a civil servant, I could not become for many reasons. But I started my life going on. I ended up doing research, achieving graduation, post-graduation, and doctorate in different topics, which actually I liked. But finally landed up somewhere called Center for Cellular and Molecular Biology as a research scientist, but not for long. Moved to another organization providing accreditation for laboratories, then for NABH. So what my philosophy has been, to please love what you do. And if you can't, please move on. Please don't waste your time, the time of the organization you are working for the whole of the country. Move on if you don't like. Once Steve Jobs said, you know, Apple, Steve Jobs, the only way to great work is to love what you do. That's a quote I have taken from. As leaders say since morning, that entrepreneurship is risk-taking, and definitely it is. But I say one more thing. In a hospital perspective, in a healthcare perspective, what is good for my hospital is good for me. If you follow that philosophy, and I'm sure many of the leaders who spoke before me actually emphasizes on that. What we started in the beginning of the humankind, and we started our journey as a human being long years ago, we always hear about a doctor, Bhagwan hai. Doctor is a God, Dr. Bhagwan hai. Caregiver, he was a caregiver. And there was a transformation, the caregiver transformed to a healthcare professional. And then there further transformation, a healthcare professional become healthcare entrepreneur or businessman. and there is no harm in such transformation if you continue with all three components together. Don't forget about the caregiving component of healthcare. I tell you a story about the professionals, healthcare professionals. It's about a hospital, a couple of resident doctors working in the hospital. What did you do yesterday? Asked the boss of those resident doctors. It was after around coffee break, and last night was quite busy. We all were exhausted with lack of sleep and lack of food. None of us was interested in a pleasant chat. We finished a laparotomy for small bowel obstruction in 20-year-old engineering student around 10 p.m. And we were heading for our dinner, reassuring all the relatives of the boy that everything is fine. Before we could walk off, there was a patient, 35-year-old electricity lineman, who fell down from a pole while work. A fast, what you call it, a clinical terminology, focus assessment with sonography for trauma, revealed a hemiperitoneum with a splenic laceration, and he was in early shock. His wife, about 30 years, walked in with a 5-year-old kid. She was clueless and almost don't know what to do. And she was too fearful when we asked to sign a consent form for the surgery. The usual, after we entered into the OR, and after about an hour, his spleen was waving permanent goodbye to his body. And we came out of the OR, and again we assured the patient that everything, the relative, that everything is going to fine. And then there was a patient came in with cellulitis in left leg, and then some pancreatitis or some problem, another patient, another patient, another patient. So when we narrated all this story to the boss, he repeated the question, what else did you do? Frustrated, irritated, all of the residents, the chief resident said, we lost one more day of sleep, dinner, and good time with the family. Now it was my boss' turn now to say something. For you, it may be a 10-centimeter segment of gangrenous bowel and a ruptured spleen, but yesterday you kept alive the hopes and love of a couple which they nurtured for 20 years. You prevented a young lady from becoming a widow and a small kid from losing his father forever. You relieved the agony of a patient who had suffered with no fault of him and helped a leg scapular from his leg getting chopped off forever, if you have not acted early. A night's sleep and dinner are nothing compared to what they might lose had we not acted there. We often don't understand the influence we exert on the lives of others as a healthcare provider. When we do, we all will be much more careful in our attitudes and actions. With a single stroke of a scalpel, we can bring a family onto the roads or can extend lives by years. By our decisions, we decide as a healthcare provider that whether a person lives or dies. We are blessed to be in a profession like this, he said, and drew the last sip of coffee and walked away. And these residents were stunned. Nothing to say more. They all got up and went on to the ward, but it was early morning to start their rounds again, with all hearts filled with pride and humility at the same time. And a lesson learned for the lifetime. As long as life exists, despite all its shortcomings, this will be the best profession and you are the real heroes. You should be proud of the profession as a healthcare provider. It's not only the doctor, nurses, paramedics, whosoever is involved in patient care. The world is moving fast, and some of my earlier speakers talked about health coverage. We're talking about universal health coverage. And I'm not sure whether you know about your health coverage component. There are 3 components. Who is covered, what is covered, and what is the cost. And this is going to be the major challenges before any one of us. be it private players, be the government, be the nation, or be the international. And how I am linking this universal health coverage to, I just spoke in another story, that they are all linked. At times we have the healthcare facility, but there is no provider available. And there is a provider available, but nobody is willing to do that. There are so many combinations of organizations existing and the services being provided. I'm dreaming, I use the word dreaming, that one day someone out of you will start a model taking care of universal health coverage. Means providing the care, and care means the quality care to a needy patient whenever is required at the cost he or she can afford. That's the crux. I call upon all healthcare leaders to lead the country in providing best of safe care. I won't say care, safe care to patients and promote global initiatives. And there are a lot of initiatives going on nationally and internationally, and you can all contribute to make things happening to the betterment of care. They are clean care is safe care. How you minimize the infections. Safe surgery saves life. How many of you using the checklist? Like always we give an example of aviation industry. That there is a checklist pilot has to follow. And I would say, and please pardon me for saying so, the pilot, if you know that if something goes wrong with the plane, I would survive, he will not follow the checklist. Here in healthcare, doctor probably or nurse probably or paramedic don't follow a checklist because he or she knows I am not going to suffer. If you make the same conditions as the pilot has for a doctor or a nurse or something, probably you will find the same results. I am mindful of the time, gentlemen. That's why I'm cutting short. So the thing is, when we're talking about training, education, doctor, nurse, and all these things, my question goes back to them, are we training our medical graduates enough to provide safer care to the patient when he comes out of the medical school? He goes through the biochemistry, pathology, anatomy, physiology, so many things, but whether has he gone through that if a test reports out of the laboratory is not what it should be, what's going to be the consequences to the patient? The doctor who is going to write the prescription based on that test report is going to be totally different. It's missing in our medical curriculum. And I'm happy to share with you the WHO has come out with a medical education curricula which can be adopted by any country to include in the medical education, to provide at least some education training to the medical graduates. Not taking much time, but it's important. I would like to share short incidents. I visited Beth Israel Deaconess Medical Center, which is one of the associated hospitals of Harvard Medical School in Boston. And we were going through the rounds of the hospital. I asked questions when we were in the ward to nursing director, because there were studies that over 100,000 deaths for medical errors, and medical errors also include medication errors as well. So I asked, how you take care of medication errors? And she showed me a machine, a vertical machine. So this is the equipment taking care of medication error. How? She said, it's all programmed, all prescriptions are automated by the doctor, prescribed on a computer, and it's take the machine take the order from there. So nurse has to take a barcoded tag from the patient, go to the machine, scan it, and different drawers will open up from different, and the amount of medicine which is required to be given to the patient will be coming out. And you just pick that and go back to and deliver to the patient. And I asked, did it work? She said, sorry, no, it didn't work. Why? Because nurses are very innovative. So our nurses are very innovative. Now how? This says, they will go to the patient 1, take that barcode, go to the patient 2, 3, 4, take the all barcodes, and here, over the code, the nursing gown code over here, so nobody would see. And go to the machine and tag it, tag 1, tag 2, tag 3, and tag 4. So get the patient medicine for 4 1. Go back and then there is a problem. So how you overcome? Say we become more intelligent. What we program the machine is now in a way that you go to the machine, take the medicine of one patient, and there is a time gap. You can't take the second patient's medicine immediately after, so you have to go back. So that's the innovation how we as a healthcare providers innovate. Not looking at the system is designed to provide safety to the patient, and we are breaching that. I went to many of the hospitals in India and observed phlebotomy. When you draw the blood, everything is clean, thoroughly. And then, just before puncture, tap. So what the hell you were doing when the whole the pain is like this? And I asked question, अरे साहब क्या करें इतने तो मरीज आते हैं. And this is you not supposed to do. Please love what you do. If you don't love what you do, please go away somewhere else. And then this is the follow. So many medicine in expiry, already expired in the crash card. I don't know what was giving me in a hand. If I put a hand in something, it goes void, already expired. What we are doing, we are not caring. What the question asked is simple. सर हम क्या करें? वो नहीं देता. अरे ये देखने के लिए तो आप हो. This is your responsibility. But we are not loving our work. We are not loving our job. I always consider myself as a student, and I always find an opportunity to learn. And this was a great learning for me today. And I walk in and heard so many speakers, their success stories, their entrepreneurial skills, and so on. And I always learn from you all sitting as there on the debate. So before I end up, I would request to please allow that to the 1 minute video clip. Shall I give it to you?
Can we have
and that video clip is not related to healthcare. It's not related to healthcare. And this was shot by my daughter 7 years ago in Kuala Lumpur. But it gives a
we have a question, I presume.
So please, and this gives me a. You're starting it? Yeah, please. It shows the doctor who is going to write the prescription based on that test report is going to be totally different. It's missing in our medical curriculum. And I'm happy to share with you the WHO has come out with a medical education curricula which can be adopted by any country to include in the medical education, to provide at least some education training to the medical graduates. Not taking much time, but it's important. I would like to share short incidents. I visited Beth Israel Deaconess Medical Center, which is one of the associated hospitals of Harvard Medical School in Boston. And we were going through the rounds of the hospital. I asked questions when we were in the ward to the nursing director, because there were studies that over 100,000 deaths for medical errors, and medical errors also include medication errors as well. So I asked, how you take care of medication errors? And she showed me a machine, a vertical machine. So this is the equipment taking care of medication error. How? She said, it's all program, all prescriptions are automated by the doctor, prescribed on a computer, and the machine takes the order from there. So nurse has to take a barcoded tag from the patient, go to the machine, scan it, and different drawers will open up from different, and the amount of medicine which is required to be given to the patient will be coming out. And you just pick that and go back to and deliver to the patient. And I asked, did it work? She said, sorry, no, it didn't work. Why? Because nurses are very innovative. See, our nurses are very innovative. Now how? They say, they will go to the patient 1, take that barcode, go to the patient 2, 3, 4, take the all barcodes, and here, over the code, the nursing gown code over here, so nobody would see. And go to the machine and tag it, tag 1, tag 2, tag 3, and tag 4. So get the patient medicine for 4. Go back, and then there is a problem. So how you overcome? Say we become more intelligent. What we program the machine is now in a way that you go to the machine, take the medicine of one patient, and there is a time gap. You can't take the second patient's medicine immediately after, so you have to go back. So that's the innovation how we as a healthcare providers innovate. Not looking at the system is designed to provide safety to the patient, and we are breaching that. I went to many of the hospitals in India and observed phlebotomy. When you draw the blood, everything is clean, thoroughly. And then, just before puncture, tap. So what the hell you were doing when the whole the pain is like this? And I asked question, अरे साहब क्या करें इतने तो मरीज आते हैं. And this is you not supposed to do. Please love what you do. If you don't love what you do, please go away somewhere else. And then there's the follow. So many medicine in expiry, already expired in the crash card. I don't know what it was giving me in a hand. If I put my hand in something, it goes boiled, already expired. What we are doing, we are not caring. What the question asked is simple. क्या हम क्या करें? वो नहीं देता. अरे ये देखने के लिए तो आपको. This is your responsibility. But we are not loving our work. We are not loving our job. I always consider myself as a student, and I always find an opportunity to learn. And this was a great learning for me today. And I walk in and heard so many speakers, their success stories, their entrepreneurial skills, and so on. And I always learn from you all sitting as there on the delegate. So before I end up, I would request to please allow that the 1 minute video clip. Shall I give it to you?
Can we have
And that video clip is not related to healthcare. It's not related to healthcare. And this was shot by my daughter 7 years ago in Kuala Lumpur. But it gives a
We have a question, I presume.
so please, and this gives me a. You're starting it? Yeah, please. It's show for it, benefits. So I'm not talking about NABH. Start from the beginning. Just look at it. Finished. What do you observe? What do you observe? Then Kuala Lumpur. And the innovative idea is here, not only cleaning the tire, making the city clean, but they can use the water, they can recycle the water. Water is not going waste. You see the ions filters, the water will go down here, collected somewhere, and that will be used for construction. So it's not healthcare, but I learned a lot from it. How you innovate things to work for your benefits, how you can innovate, how can you use the resources in optimum manner while we're talking about healthcare industry. We are short of doctors, nurses, and hospitals, but we can optimize the things. And even though we can work better and keep the interest of the community, the city, to keep it clean. I have gone to a number of sites in Noida State, Noida and Delhi. I could not find even a single company doing it. Why we are not doing it? It's not a rocket science. Ladies and gentlemen, thank you very much for the patient hearing. I know I'm not a leader, I'm not a good speaker, but I thought let me share what I want to share. Not NABH accreditation, not NABL accreditation, but something it actually keeps asking me question and question what you are going to do to make your patient safe and safe. Thank you very much. Jai Hind.